What is chromium? Chromium is a mineral. It is called an essential trace element because very small amounts of chromium are necessary for human health. There are two forms of chromium, trivalent chromium and hexavalent chromium. The first is found in foods and supplements and is safe for humans. The second is a known toxin that can cause skin problems and lung cancer. Chromium is used for improving blood sugar control in people with prediabetes, type 1 and type 2 diabetes, and high blood sugar due to taking steroids and HIV treatments. It is also used for depression, Turner syndrome, polycystic ovary syndrome, PCOS, lowering bad cholesterol, raising good cholesterol in people taking heart medications called beta blockers, metabolic syndrome, heart attack, schizophrenia, bipolar disorder, and binge eating disorder. Some people try chromium for body conditioning including weight loss, increasing muscle, and decreasing body fat. Chromium is also used to improve athletic performance, to increase energy, and to prevent age-related mental decline. Chromium is used intravenously, by 4, as a supplement in nutritional 4 drips. How does it work? Chromium might help keep blood sugar levels normal by improving the way our bodies use insulin. Uses and effectiveness. Likely effective for chromium deficiency. Taking chromium by mouth is effective for preventing chromium deficiency. Possibly effective for diabetes. Some evidence shows that taking chromium picolinate, a chemical compound that contains chromium, by mouth, either alone or along with biotin, can lower fasting blood sugar, lower insulin levels, and help insulin work in people with type 2 diabetes. Also, chromium picolinate might decrease weight gain and fat accumulation in people with type 2 diabetes who are taking a class of anti-diabetes medications called sulfonylureas. Higher chromium doses might be more effective and work more quickly. Higher doses might also lower the level of certain blood fats, cholesterol and triglycerides, in some people. Early research suggests that chromium picolinate might have the same benefits in people with type 1 diabetes, people who have diabetes as a result of steroid treatment, and people with diabetes that develops during pregnancy. However, researchers are looking carefully at the results that show chromium might be effective for treating diabetes. It might not help everyone. Some researchers think that chromium supplements benefit only people with poor nutrition or low chromium levels. Chromium levels can be below normal in people with diabetes. High levels of cholesterol or other blood fats. Some research shows that taking 15 to 200 micrograms of chromium daily for 6 to 12 weeks lowers low-density lipoprotein, LDL or bad cholesterol in total cholesterol levels in people with slightly high or high cholesterol levels. Other research suggests that taking chromium for 7 to 16 months lowers triglycerides and LDL, and increases high-density lipoprotein, HDL or good cholesterol. Also, taking chromium alone or along with other supplements seems to reduce levels of blood fats in people with high blood fat levels. However, there is some evidence that taking chromium daily for 10 weeks does not improve cholesterol levels in postmenopausal women. Possibly ineffective for athletic performance. Some early evidence that suggests taking chromium while participating in resistance training can increase weight loss, body fat loss, and lean body mass. However, most reliable research shows that taking chromium by mouth does not enhance body building, strength, or lean body mass. Binge eating disorder. Research suggests that taking chromium picolinate by mouth daily for 6 months does not affect weight, depression symptoms, or the frequency of binge eating in people with binge eating disorder. Prediabetes. Taking chromium does not seem to help control sugar levels in people with prediabetes. Obesity. There is some conflicting evidence about the effects of chromium on obesity. Some limited research suggests that chromium might improve weight loss in some people who are overweight or obese. But the amount of weight loss is probably not clinically significant. Furthermore, most research suggests that taking chromium by mouth does not improve weight loss. Schizophrenia. Research shows that taking 400 micrograms of chromium daily for 3 months does not affect weight or mental health in people with schizophrenia. Insufficient evidence to rate effectiveness for age-related mental decline. Research suggests that taking 1000 micrograms of chromium daily for 12 weeks does not improve memory or depression in older people with mild mental decline. However, images of the brain show that taking chromium can increase some brain activity during memory games. High blood sugar associated with HIV treatments. Early research suggests that taking chromium nicotinate or chromium picolinate daily for 8 to 16 weeks might help reduce insulin resistance in HIV patients receiving antiretroviral therapy. A type of depression called atypical depression. Early research suggests that chromium picolinate might improve the remission rate in people with atypical depression. However, other evidence suggests that taking chromium picolinate does not improve most symptoms of this type of depression. Abnormal cholesterol levels caused by medications. Early research suggests that taking 600 micrograms of chromium daily for 2 months increases high-density lipoprotein, HDL or good, cholesterol in men who take a class of drugs called beta blockers. Bipolar disorder. Early research suggests that taking 600 to 800 micrograms of chromium chloride daily for up to 2 years can decrease the frequency of severe mood disturbances in people with bipolar disorder that is resistant to treatment. Long-term depression, dysthymia. There is some early evidence that chromium might improve how people with long-term, mild, depression respond to antidepressants. Taking chromium picolinate or chromium polynicotinate seems to improve mood in people who only partially respond to antidepressants. Low blood sugar. Early research suggests that taking chromium chloride daily for 3 months improves symptoms and increases blood sugar levels in people with low blood sugar. Other early research suggests that taking chromium, Biochrome, Pharma Nor, Denmark, by mouth daily for 3 months improves symptoms, including chilliness, trembling, and disorientation, in people with low blood sugar. Metabolic syndrome. Early evidence suggests that taking a specific chromium product, Chromax, Nutrition 21, Purchase, NY, twice daily for 12 weeks does not affect weight, waist circumferences, blood sugar, or cholesterol levels in people with metabolic syndrome. Heart attack. Research suggests that having low chromium levels in the toenail is associated with an increased risk for heart attack. However, toenail levels might not accurately measure chromium levels in the body. There is no reliable research showing that chromium supplements can prevent a heart attack. An ovary disorder known as polycystic ovary syndrome, PCOS. Early research suggests that taking chromium picolinate once or twice daily might improve the removal of sugar in women with ovarian disease. However, other early research shows that taking chromium does not benefit women with this disease. Turner syndrome, an inherited disease that often leads to diabetes. Early research suggests chromium supplements might improve the processing of sugar and fat in people with Turner syndrome. High blood sugar related to steroid use. Other conditions. Side effects. Chromium is likely safe for most adults when taken by mouth, short term. Up to 1000 micrograms/day of chromium has been used safely for up to 6 months. Chromium is possibly safe for most adults when taken by mouth for longer periods of time. Chromium has been used safely in a small number of studies using doses of 200 to 1000 micrograms daily for up to 2 years. Some people experience side effects such as skin irritation, headaches, dizziness, nausea, mood changes and impaired thinking, judgment, and coordination. High doses have been linked to more serious side effects including blood disorders, liver or kidney damage, and other problems. It is not known for sure if chromium is the actual cause of these side effects. Special precautions and warnings. Pregnancy. Chromium is likely safe to use during pregnancy when taken by mouth in amounts that are equal to or less than adequate intake, AA, levels. The AA for pregnant women 14 to 18 years old is 29 micrograms daily. For pregnant women 19 to 50 years old, it is 30 micrograms daily. Chromium is possibly safe to use during pregnancy in amounts higher than the AA levels. However, pregnant women should not take chromium supplements during pregnancy unless advised to do so by their healthcare provider. Breastfeeding. Chromium is likely safe to use while breastfeeding when taken by mouth in amounts that are equal to or less than adequate intake, AA, levels. The AA for breastfeeding women 14 to 18 years old is 44 micrograms daily. For breastfeeding women 19 to 50 years old it is 45 micrograms daily. There is not enough reliable information about the safety of taking higher amounts of chromium if you are breastfeeding. Stay on the safe side and avoid use. Children. Chromium is likely safe when taken by mouth in amounts that do not exceed the adequate intake, AA, levels. For infants 0 to 6 months old, the AA is 0.2 micrograms daily, 7 to 12 months, 5.5 micrograms. For children 1 to 3 years old, the AA is 11 micrograms, 4 to 8 years old, 15 micrograms. For boys 9 to 13 years old, the AA is 25 micrograms. For girls 9 to 13 years old, the AA is 21 micrograms, 14 to 18 years old, 24 micrograms. Taking chromium by mouth is possibly safe when used in amounts that exceed the AA levels. Behavioral or psychiatric conditions such as depression, anxiety, or schizophrenia. Chromium might affect brain chemistry and might make behavioral or psychiatric conditions worse. If you have one of these conditions, be careful when using chromium supplements. Pay attention to any changes in how you feel. Chromate leather contact allergy. Chromium supplements can cause allergic reactions in people with chromate or leather contact allergy. Symptoms include redness, swelling, and scaling of the skin. Diabetes. Chromium might lower blood sugar levels too much if taken along with diabetes medications. If you have diabetes, use chromium products cautiously and monitor blood glucose levels closely. Dose adjustments to diabetes medications might be necessary. Kidney disease. There are at least 3 reports of kidney damage in patients who took chromium picolinate. Don't take chromium supplements if you already have kidney disease. Liver disease. There are at least 3 reports of liver damage in patients who took chromium picolinate. Don't take chromium supplements if you already have liver disease. Interactions. Insulin interaction rating, moderate. Be cautious with this combination. Talk with your health provider. Insulin is used to decrease blood sugar. Chromium might increase how well insulin works. Taking chromium along with insulin might cause your blood sugar to drop too low. Monitor your blood sugar closely. The dose of your insulin might need to be changed. Levothyroxine, Synthroid, Levothyroid, Levoxel, and others. Interaction rating, moderate. Be cautious with this combination. Talk with your health provider. Taking chromium with levothyroxine, Synthroid, might decrease how much levothyroxine, Synthroid, that the body absorbs. This might make levothyroxine, Synthroid, less effective. To help avoid this interaction, levothyroxine, Synthroid, should be taken 30 minutes before or 3 to 4 hours after taking chromium. Medications for diabetes, anti-diabetes drugs. Interaction rating, moderate. Be cautious with this combination. Talk with your health provider. Chromium might decrease blood sugar. Diabetes medications are also used to lower blood sugar. Taking chromium along with diabetes medications might cause your blood sugar to go too low. Monitor your blood sugar closely. The dose of your diabetes medication might need to be changed. Some medications used for diabetes include glimepiride, Amaryl, glyburide, Dial-beta, Glinase Pre-Tab, Micronase, insulin, metformin, glucophage, pioglitazone, Octos, rosiglitazone, Avandia, and others. Aspirin. Interaction rating, minor. Be cautious with this combination. Talk with your health provider. Aspirin might increase how much chromium the body absorbs and increase chromium levels in the blood. In theory, taking aspirin with chromium might increase the risk of adverse effects. NSAIDs, nonsteroidal anti-inflammatory drugs. Interaction rating, minor. Be cautious with this combination. Talk with your health provider. NSAIDs are anti-inflammatory medications used for decreasing pain and swelling. NSAIDs might increase chromium levels in the body and increase the risk of adverse effects. Avoid taking chromium supplements and NSAIDs at the same time. Some NSAIDs include ibuprofen, Advil, Motrin, Nuprin, others, indomethacin, Indocin, naproxen, Aleve, Anaprox, Naprelin, naproxen, piroxicam, Feldene, aspirin, and others. Dosing. The following doses have been studied in scientific research. Adults. By mouth. General, the safe and tolerable upper intake levels of chromium are not known. However, daily adequate intake, AA, levels for chromium have been established. Men 14 to 50 years, 35 micrograms, men 51 and older, 30 micrograms, women 19 to 50 years, 25 micrograms, women 51 and older, 20 micrograms, pregnant women 14 to 18 years, 29 micrograms, 19 to 50 years, 30 micrograms, breastfeeding women 14 to 18 years, 44 micrograms, 19 to 50 years, 45 micrograms. For diabetes, in people with type 2 diabetes, 200 to 1000 micrograms of chromium taken daily in a single or divided doses has been used. Also, a specific combination product providing chromium 600 micrograms plus biotin 2 mg daily, Diachrome, Nutrition 21, has also been used for up to 3 months. In addition, 1000 micrograms of chromium, as chromium yeast, together with 1000 mg of vitamin C and 800 IU of vitamin E daily for 6 months has been used. In people with gestational diabetes, 4 to 8 micrograms/kg of chromium picolinate daily for 8 weeks has been used. In people with high blood sugar due use of corticosteroid medication, 400 micrograms of chromium once daily or 200 micrograms 3 times daily has been used. For high cholesterol, 50 to 250 micrograms of chromium as chromium chloride or chromium picolinate, or brewer's yeast containing 15 to 48 micrograms of chromium, has been used 5 to 7 days weekly for up to 16 months. 200 micrograms of chromium polynicotinate along with 100 mg of grapeseed extract, taken twice daily for 2 months, has been used. 1 to 2 capsules of a specific supplement, Cholinon, containing 240 mg of chitosan, 55 mg of Garcinia cambogia extract, and 19 mg of chromium taken daily for 4 weeks has been used. Children. By mouth. General, the safe and tolerable upper intake levels of chromium in children are not known. However, daily adequate intake, AA, levels for chromium have been established. Infants 0 to 6 months, 0.2 micrograms, 7 to 12 months, 5.5 micrograms, children 1 to 3 years, 11 micrograms, 4 to 8 years, 15 micrograms, boys 9 to 13 years, 25 micrograms, girls 9 to 13 years, 21 micrograms, 14 to 18 years, 24 micrograms. For high cholesterol, 400 to 600 micrograms of chromium polynicotinate and 1000 to 1500 mg of glucomannan has been used twice daily for 8 weeks.